to know that that's what the actions of TFL is. There is no actions of the iliotibial tract because it's not a muscle. It's just connective tissue fascia. Notice the posterior aspect of TFL is where gluteus maximus is blending into. Okay, now we're going to go to page 326 for the longest muscle in the body, sartorius. So you might want to highlight that because the longest muscle, those are the type of questions the state likes to ask. What's the shortest? What's the strongest? You know, what's the longest, etc., etc. So sartorius. And if you remember that sartorius begins with an S, it will kind of help you with the shape of it because it starts at the anterior superior iliac spine, where we can see that right here, either space. And then it inserts down into that same spot, the pes anserinus. So far we've talked about semitendinosus as attaching into this spot. We've talked about gracilis attaching into this spot. And now we have sartorius. So there is 3 muscles that are attaching into this little weird spot. So now that we've talked about all 3, I want us to look at this specific spot, and I'm going to talk you through palpating it, but we're also going to do it in class time. So you need to turn ahead to page 352 to find the pes anserinus attachment site. The top of page 352. So let's just look at the right-hand picture. We have our patella, so our kneecap bone. We have both sides, medial and lateral, of our femur. So right at the point, this little heart-shaped patella, we go down in the center. We have the tibial tuberosity, where what group of muscle attaches to? Hopefully you said quads. So this is where our quads are going. And then we have the pes anserinus attachment site. So this is an anterior view of your right knee. So I want you to reach down and touch that spot, the tibial tuberosity on your right knee. And because we're looking at the front, this is the outer, smaller bone. So it's the one that's on the outside. The tibia bone is the center one. So we need to find tibial tuberosity and go off to the side, which actually is going to be medial. The small bone is lateral, so we're going to go medial to that tibial tuberosity. So find tibial tuberosity, go medial. It's a little indent. Your thumb will fit in there perfectly. That's where semitendinosus, sartorius, and gracilis all come. So it's an important spot. And when we look at the actions of these 3 muscles together, you can see how this spot is going to be huge. When people talk about they potentially have a restriction or pain or discomfort in their leg, because between these 3 muscles, they're doing like all of the actions of our leg. So back to page 326. So that was just looking at the insertion site, pes anserinus. You need to remember those 3 muscles that attach there. So we have for sartorius, this long muscle of the body. Anterior superior iliac spine as the origin. Proximal medial shaft of the tibia at the pes anserinus tendon for insertion. But this little action right here, being the talar position, or if you cross your ankle over your other knee, so figure 4, you can call it that too. This is what sartorius does. So sartorius has 5 actions, which is making this talar position happen. So you can understand how the longest muscle in our body is going to do these 5 actions, and then it actually can have a restriction in our knee movement because of all of those actions. I want you individually to go through each of these and see if you can get into that position. We'll talk about all the actions at the end, but here's your perfect picture. That's all you have to do. Here's another picture. So kind of the figure 4, talar position. The Technically, the ankle can be below the tibiofemoral joint, doesn't have to be above, so just somewhere in this position. You might be able to feel sartorius because it is a little clunky. Sometimes it goes right by the ligament, so it can even be a little tender. So it just depends on the area. The next group, so luckily we just had one there, so we had TFL and then sartorius, each one muscle. The next one is a group of 6, except there is always going to be exceptions. So we have the lateral rotators of the hip. I bet you can guess that they do lateral rotation, so that's the plus. But when you look at the breakdown of the names, look at, they don't have any of that in there, so they're not really giving us much of a cheater. But of these, piriformis, 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 you need to know everything about piriformis. You need to know origin, you need to know insertion, you need to know that it affects nerves, and we'll talk about that here, and you need to know the actions. So let's look at this top picture of piriformis. Look at where it is, and then look at, here's our lovely sciatic nerve. Piriformis is the one that typically is, that people call, oh, my sciatic is hurting me. Piriformis syndrome, okay? So in order to locate exactly where these spots are, yeah, we have the origin and insertion, but I'm going to give you a different view that's going to make it a little easier. So we just have to, unfortunately, turn the page in order to find this. On page 330, top or left-hand picture, here's the 3 spots that are going to, you need to know these 3 spots or this T position in order to locate anyone's piriformis. So we are going to find their coccyx, right? I said you'd be touching it. What's that spot called where coccyx is located? There's a technical term for it, or a proper term. You need to know it. Posterior superior iliac spine, so where the pelvis and the sacrum are coming together. And then the greater trochanter on the outside of that femur. When you make that perfect T, you're identifying exactly where someone's piriformis is, which actually means you are going to be finding what muscle is compressing that sciatic nerve and causing that piriformis syndrome, or I had tingling down my leg, my sciatic is hurting me type thing. So everything about piriformis you need to know. Obviously, this group is going to have an all-fire action of lateral rotation. So other than piriformis, I want you to know that there is 6 lateral rotators, right? And they all do lateral rotation. Separately, piriformis is not only the rock star because of what it does, it compresses that nerve, but also it abducts the hip when your hip is flexed. So if you're sitting right now, you have flexed your hip, and if you have your knee kind of more to the outside or your femurs are separate, you're abducting your hip, and if your toes are pointing more towards your pinky side or laterally, you're doing both, and you're making piriformis very pissy. That's what we call the syndrome. So everything about piriformis, origin, insertion, action, and the nerve, you need to remember. You need to know how to locate piriformis in that T. Other than that, I want you to be aware of the names: quadratus femoris, obturator internus, obturator externus, gemellus superior, gemellus inferior. I'm not going to ask you to identify those, and historically the state does not ask you those things either, but you do need to know that there is 6 lateral rotators, and then again, everything about that piriformis. The next couple pages are giving you individual views of where each one of these lateral rotator muscles are located. Perfect. I'm happy that you can look at those. You don't need to focus too much time on them. Your workbook will take you through all of those. On the bottom of 330, Just showing some other areas of what you might palpate when you're feeling, especially piriformis. Sometimes when you do a flexed knee and you move that foot side to side, you might feel piriformis. Sometimes this T identification will always work. And as you know, I strongly encourage you to be able to locate the bony landmarks rather than moving the client. On to page 332. I promise you we're getting down towards the end. I know it's a lot of muscles when you add them all up, but the groups do help, and this is our last two muscles or two muscles that make up a group, and of course there has to be confusion with it. So we have page 332 for the iliopsoas, which is psoas major and iliacus. So you can talk about them separately, psoas major, iliacus, or you can say iliopsoas. You need to be familiar with both. We're going to look at the bottom because it's easier to tell them apart. Psoas major, and you can see it in your book, we can't see it on the screen, but notice it's attaching to the lumbar vertebrae, and then it's going down to that lesser tubercle, the inside or the medial part of the femur. Then we have iliacus, which separately is going to be the inside of this iliac fossa. It also attaches down to that lesser tubercle the lesser tuberosity, of the femur. So the inside medial portion of the femur, oh my gosh, this is the greater trochanter and the lesser trochanter. I apologize, my terms are getting all mushed together here, but so you can see how different origin areas, but they come down to the same exact spot, the lesser trochanter. Wow. Together, they do some actions that are the same, so you could say they have all fire actions. If you look at the actions, they both flex the hip, so they're hip flexors. No, you're not going to be able to palpate any of this part of origin or insertion of either one of these muscles, okay? Maybe a smidgen if you can curl your fingers around that iliac crest, maybe, but you got a lot of abdominal contents right here. So all fire action to flex the hip. They also have an all fire action to tilt the pelvis anteriorly. So right here on the bottom, they're going to tilt the pelvis anteriorly. So we talked about the hamstrings doing posterior tilt. We talk about TFL, tensor fascia latae, being able to do anterior tilt. So if I asked you to take your sacrum and bring your sacrum up to the ceiling, that is anterior tilting your pelvis. You could also say that it's sort of kind of like a wedgie. So that is changing your pelvis. So these two have the action of anterior tilt of your pelvis, opposite of hamstrings. So that is important to remember when people are not in a neutral pelvis, or perhaps they're complaining of lower back pain or lumbar pain. What can you do about that? Yes, you can work with the hamstrings, because the hamstrings are antagonists to these two muscles, because these two muscles are inaccessible to us because of all the deep abdominal contents. You know, we can't really get rid of all those things. Sometimes, again, maybe in a sideline position, you might be able to get a smidgen of origin of iliacus, maybe not. Just depends on the client. We will do that during our hands-on time, and you'll see how difficult that can be. Just a little breakdown. So the top of 333, just showing where that origin of psoas is. Again, lumbar vertebrae, all the way down to this middle center part of our femur. Iliacus being on the inside of that bowl of our pelvis. So again, showing why they're definitely inaccessible. You do not have to memorize this picture, but it might be an interesting one to look at for your viewing. Just showing this is L5, the lumbar vertebrae, where psoas major is right on those vertebrae. Again, remember, low back pain, low back discomfort. iliacus being a little wider, a little further out. This is just indicating the ilium bone, so part of our hip. But then look at all these darn intestines in our way, right? So we have a really hard time of being able to get down to feeling where these two muscles are located. On page 335, this is where I was describing that perhaps in the sideline position, maybe you can do this, but you'll see during class time it's sort of kind of uncomfortable. So it might not work as well as we think. And that is the end of our muscles. I know you are just so not happy that we're out of all of those muscles. But unfortunately, we have a couple more things to look at as an overview before we talk about the actions. So I want you to turn to page 296. And just as an overview, this is a lovely page that you want to study or visually be able to identify. Yes, it is in your workbook, so that will absolutely help you going through naming all of these muscles. I want you to also notice that the muscles of the pelvis and thigh create movement at the coaxial or hip and the tibiofemoral joint. So when you're breaking down all of these muscles on this page, or 297, another visual one you want to help study for your chapter test with, but when we're breaking them down, even on the next page, 298, just make sure you look at the views of where these muscles are located. That will help you. And the other page, 299, again, breaking down. No, it is identifying more muscles than I'm asking you to know, but we have to remember that all of these muscles are either going to move something in our pelvis or our hip or our femur. And there is a couple that are going to have actions down at our knee, but not all of them. All right, so we want to remember that. When we look at this bottom picture on 299, you can understand how when we have our pelvis tilted anteriorly or posteriorly, all of these muscles are going to be changed. Our pelvis does not move there without a muscle making it happen. So that is very important. One more thing I want to say on page 300 at the top. 300 and 301 are looking at the pelvic floor muscles or the entire pelvic floor area. You don't need to memorize any of it, but you do need to know that the pelvic floor supports the abdominal and pelvic viscera. So all of the muscles inside our pelvis are being supported by these pelvic floor muscles. Yes, it is a muscle, but you are going to have to take specific training if you want to be able to work on the pelvic floor muscles. So we'll get to look at them, but you're not going to be able to focus in on them until after you take some additional training. So the last thing that I want you to focus in on is the actions. So these are starting on page 302. Okay, so let's just focus on first, this is our coaxial, our hip joint, and we have flexion of the hip. So it's bringing our femur forward. So when you look at this list, wow, that's a big list. But I want you to notice how we have our assisters here. And I also want you to notice that as a group, that is the adductors. So we can think, okay, the medial side of our femur is going to have some assistance here, but those are just the assisters. Then I want you to think if the muscles on the front of my femur, would they be bringing my femur forward? And then you'd have to remember what those muscles are. So we have rectus femoris, right? That is on the front of our femur. It's going to be pulling it forward. Tensor fasciae latae, that little bitty muscle up here, it's on the front, so it's going to be bringing our femur forward. Sartorius being the longest muscle in the body, it's on the front of the femur. it's going to be pulling it forward. The two that might be slightly challenging is psoas major and iliacus. They are on the front, but they're attached to that lesser trochanter on the inside of the femur. So technically they are on the front, so they're going to be doing flexion. And then for whatever weird reason, we have two gluteal muscles. Gluteus medius, the anterior fibers, and gluteus minimus, because they do everything together. So look here, here's gluteus medius, and then deep to that would be gluteus minimus. They're technically, we think of them as being on the side, but really they're on the front. So gluteus medius and gluteus minimus, you have to remember they have anterior portion, and that's why they're moving into flexion or bringing that femur forward. Down to the bottom of page 302 for extension. So this is where I'm going to pull your femur backwards. So then we want to think of, okay, if that's pulling my femur back, then probably it's the muscles that are on the back of the femur. So as a group, we have two groups that have stuff on the back. We have our hamstrings, bicep femoris, semitendinosus, and semimembranosus. There's three out of them that are pulling it back. We have our gluteus maximus, which is on the back side. So of course it's going to be pulling our femur back, because remember it's attached to that iliotibial tract and the line on the back of the femur. Then we have gluteus medius, a little bit easier. So gluteus medius, if you look up here, it has flexion and extension because it has fibers on the anterior portion and posterior, so or the side or the back. And then the last one that is a little bit harder to think about is adductor magnus. If you go back individually and look at the pages of where adductor magnus is located, you will see that a large portion of it is kind of on the fleshy part, separate from the hamstrings. So in the picture, it's right here. So it's a little separate. So it's an adductor, so it's more on that inner groin area. So that's our adductor magnus. So technically they're all in the back. Flexion, all on the front. So keeping in mind we're just talking about the hip joint. The top of page 303, just to look at medial rotation. So for medial rotation, yeah, it looks like there's a lot going on there, but I'm going to break it down a little bit easier. We have two glutes, 5 adductors, 2 hamstrings, and then TFL. It's a little easier to think of, wow, that's a lot of 10 muscles going on there, but we have the 2 glutes, medius and minimus. We have 5 adductors, which 3 of them tell you adductor in the name, and then you have the shortest and most medial, and then the longest and most on the outside of the medial portion of our femur. So that's our 5 adductors. We have 2 hamstrings that are assisting, our 2 semis, because remember, they are attaching on the medial portion of our femur. And then tensor fascia latae, can you remember where that little guy is? Right up in here. So medial rotation or internal rotation is bringing that femur and medially rotating it, because that's what we're talking about, the hip joint. The opposite is lateral rotation. So now I'm going to take my femur and I'm going to laterally rotate it. So I bet you can guess that on this whole big group, all of our lateral rotators are going to be part of it. So this is our lateral rotators. There's 6 of them, right? Remember piriformis being the most important one. Then we have gluteus maximus. So in this picture on the left-hand side, you can see it's on top of or superficial to all of these lateral rotators. that might help you be able to understand why gluteus maximus is doing lateral rotation or external rotation, so rolling that femur out. Then we have a little harder thing to try to figure out the rest of them. We also have gluteus medius posterior fibers. So in the picture, it's right up here. Here is gluteus medius. Then we have psoas major and iliacus. So you could say that they could make one. So here's psoas major, here's iliacus. So they're separately doing those two actions. Sorry, my pen clicked off, so now we got all those. And then, if you remember that bicep femoris, so bi means it has two heads, it attaches to the lateral aspect, so it's going to do lateral rotation. So the most important thing about who does medial or who does lateral is, can you remember where the muscles are located? Because that's going to help you the most. So when you go through these, make your flashcards, write up your list. Can you decide where this muscle is located? Because it's going to help you with the action. Still talking about the hip joint. Now we're going to go to abduction, which is taking your femur separately. So if you were standing with your feet apart, you would be in abduction of your hip. So right off, this is an all-fire action of all three glutes. Easy. You got 3 out of the 6. Then tensor fascia latae. So that little bitty muscle up here in the front, if you put a big old weight around your ankle and then separated your feet, you could feel TFL struggling a little bit to keep that out. Sartorius, the longest muscle in the body. Remember, we have to make that tailor position or that figure 4. Part of that action is abduction. We have to move our femur out in order to take an ankle and cross it up towards this knee. And then the very last one, which has a little asterisk to it, if you are sitting or your hip is flexed, then you are using your piriformis to get that femur to go out. Remember that T position of locating where piriformis is? So part of that is abduction. That's taking that movement of the femur out away from the other, or separating your feet. The opposite of abduction is adduction. So now we're going to bring our femurs together. So I bet you can guess that all 5 of the adductors are going to make that happen super easy. That's 5 out of the 6. And then we have big old gluteus maximus, the lower fibers attached to the back of the femur that are going to bring those femurs together. Again, just thinking of where they're located will help you with the actions. So those were the actions of the hip, of the coaxial joint. Now we need to add in the knee, or the tibiofemoral joint. When we do chapter 7, you'll have some more actions, but here is the starting of that. So for flexion of the knee, which you can see is bending your knee, or you can think of bringing your heel up towards your glute, however you want to think of that. So we have all fire action of the hamstrings being the first. So the hamstrings are in the back. They're going to bend that knee because they all attach down onto the lower extremity. Gracilis is the inseam adductor. So, but remember those 3 that attach to the pes anserinus site? It was sartorius, gracilis, and semitendinosus. So that's that little pes anserinus site right there. That's all that you have to memorize for this chapter or be aware of, because these 3 are from the next chapter. So I'm going to make a little line that you only have to focus in on these top 5 that do flexion of the knee. The opposite is extension. And this is easy because it's an all-fire action. This is where I'm going to take my knee and straighten it. If you remember that the quads all attach below the knee, boom, you're done. Extension. All fire action of the quads. The last two actions, and I know you're super excited about that, we have medial rotation of the flex knee and lateral rotation of the flex knee. So I'm going to start with the lateral rotation. So your knee is bent and you're going to move it out. So you're sitting and we're going to pull that knee out. There's just one. It's that hamstring that's on the lateral side, or bicep femoris. The opposite, medial rotation, we are going to have to remember that pes anserinus attachment site because we have sartorius, gracilis, and semitendinosus. But remember the two semis do the same action because they're on the medial side, so then we can add in the other semi. And then that last one, popliteus, the next chapter, don't worry about it. So medial rotation of the flex knee, the two semis because they're on the medial side, and then the other two that are on that pes anserinus attachment site. That's it. All done. I know it was a lot. I absolutely know that it's a lot. The good part about having it done this way is you can go back, listen, separate, think about the bones, think about the other structures, go through individually the muscles. Don't forget they're all in lovely groups, so that always helps.